Welcome to HorseChannel.com's exclusive equine healthcare video series with Dr. Janice Posnikoff. Dr. Posnikoff heads up Orange County Equine Veterinary Services in Southern California, and today she's giving us some pointers on how to correctly take a horse's vital signs.
Knowing your horse's vitals, why is this so important? Well, one, we love our horses, and we want to do the best for our horses. The best thing an owner can do to help me as a veterinarian is know what's going on. This particular horse, named Sadie, is super happy to be with us today. And of course, she's scourging me, looking for that treat that just might be there. And she willingly takes it when I give it to her. That's the first vital. She has an appetite. She's interested in me. The look in her eye is happy. She's interacting with me. She wants to be with me. She's not unhappy or sad in any way. And I always tell owners, that's the first thing, the look in your horse's eye. Second, and these are really big things and why it helps us out as veterinarians, is if you let us know what a heart rate is, what the temperature is, what their respiration is, immediately we can grab all the problems together and we can create a list in our heads of all the diseases that might be going on. And of course, the top ones that we always think about are colic and colds. And that's the top two things that'll get us out in the middle of the night to come see you. So today, what I'm going to do for you is actually go through how to take a heart rate, how to look at the gums to check for blood flow out to the extremities, which is a sign of blood pressure, and also a sign of whether or not there's toxins going through the body, and take a temperature and listen to the heart and lungs. So I think to begin with, we'll start at the top of the horse, at the head, and we'll move back. So the very first thing that I do when I'm doing an exam is I come up to the horse and I just lift the lip and I take a look at the gums. Now, the gums are great in that they can let us see how the blood flow is through the extremities of the body, and that gives an idea of how the heart is pumping. So what I do is I take my finger and I press down on the gums, and that pushes out all the blood from all the little tiny capillaries, and they should immediately fill up again, and so the area turns pink. The other thing that it lets me do is it lets me look at the hydration of the horse. So if the gums are really tacky or dry, and this is not a good look because she's gotten dry over a couple seconds, but when I lift her lips, I see it's nice and moist and glistening. That's a good indication of hydration. A lot of people like to pinch the skin and stuff, but on an older horse, the skin pinch test might actually not be accurate. But if you see nice moist gums, that's a really good indication of a healthy horse. Now, if the gums are really bright red, or there's a bright red line over top of the teeth, that's an indication that toxins are actually being absorbed by the body and that the horse is actually a lot sicker. Or if the gums are blue, that's a really strong indication that the horse is really sick. The second thing as we come on back down is we want to take a look at the heart, which is right here behind the front left leg is the easiest place to listen to the heart, and right behind the elbow, kind of in this whole region. The easiest way to take the heart rate is to get your stethoscope in the right place with your earpieces the right way so you can hear it. And then I listen for 15 seconds and take the count for 15 seconds. Once I have the count for 15 seconds, then you times by 4. That's your actually beats per minute. Most horses, like I said, will be between 36 to 40. Sometimes if they're a little agitated, they'll be about 44, maybe 50 if they're really worked up, but they should immediately come down to around the 40 range. If you have a 60 heart rate or higher, that's a really sick horse. This is the lung field all through here that you can just listen to different areas, and you can listen again for 15 seconds and times by 4. That'll give you the respiration per minute, and that's what you want to give to the veterinarian. Then the final thing on the big vitals, kind of in this whole abdomen chest area, is the abdomen itself. The horse's intestines are all packaged up on this side and on the other side, and we group it into 4 quadrants. So the best way to listen for gut sounds is to kind of section this back part into a top and bottom, left and right. And then again, the easiest way is just kind of look at the flank, set it in between there. You want to kind of get off of the ribs, which are running back here, so that you can actually hear gut sounds. Now the gut sounds are going to be sporadic. They're not going to be constant. So you want to just listen for a little bit of time, say like 15, 20 seconds. They'll just give you an idea of what's going on. If you don't hear anything, don't panic. Just make that a note, and then go to your dex area, which is lower down. And I actually go low on the belly, down in about that area. And if you're patient and just kind of listen, our friend here has great gut sounds. If you can't hear anything, that's important information to give a veterinarian. The very final thing when it comes to TPR is the temperature. And TPR stands for temperature pulse respiration. We've done the pulse, we've done the respiration, we're going to do temperature. Of course, Sadie, she's let me know how good of a girl she is. She wants a cookie for that. There's two ways to take the temperature, or two modes of taking temperatures. One is with the glass thermometer and the other is with the digital. The glass thermometers, because of the mercury, are starting to become more difficult to find. So if you have one, that's fine. If you can't find one, digitals are fine from the drugstore, no problem. I like the digitals because I think they're quicker. The problem is if you get them wet and stuff, they die quicker. The glass ones do have the potential to break, so you need to be careful. Before you put a glass thermometer into the rectum, and that's how we take horses' temperatures, is rectal temperature, you do need to shake it down. And it's kind of hard sometimes to see the mercury, so I just kind of go back and forth to make sure you see your mercury level and make sure it's down. So, of course, our horse's comfort is always in mind, so I use a little bit of lube to make sure that the thermometer can go in easily. Some people use Vaseline, which is okay, but it's preferred to use lubricant. And you just insert the thermometer into the rectum most of the way, at least 2/3 of the way. And leave it in for approximately 2 minutes is what you need to get a good, accurate temperature. Now, if you're using a digital, you actually have to hold it. If you've got glass, you can tie a little string to the end of the glass and let the tail come down and just hold the string. Some horses don't like this, and be careful. Notice my positioning beside the horse. If she decides to kick, she can't kick me. She only can kick out. If she does try to kick sideways, all she's going to do is push me away from her instead of actually kicking me.
Thank you for watching this segment of HorseChannel.com's exclusive equine healthcare series with Dr. Janice Posnikoff. Please remember that any equine healthcare issues or concerns should always be discussed with your veterinarian.